Surgeon Dr. Emmer Glani is there, and today I will discuss about all the suturing techniques. This is the most basic topic basically in the field of surgery. Either if you are a technician, you are a medical student, you are a house officer, you are a resident surgeon, or you are the expert surgeon. And this is the most basic and the most precious technique which you must master. And it comes with practice. So let's. Now the first and the very basic type of suture, it is the simple suture. You enter at 90 degree and you exit from the 90 degree, and you will sweep from the tissue, and after that tie the knot, and it's the instrumental tie, and you will remain between the V, and your knot should be either on one side, it should not be over the incision side, and then after that cut it. So again, just focus on the movement, how we are taking the tissue, and then again sweep from the tissue. Now instrumental tie, and the reef knot should be sitting so that the knot security is not the issue. Now this is the final view. Simple buried suture, and you will focus there. You will take the equal bites on both the sides. You will take some of the deeper tissue. You will enter from the inside and you will come to the outside. Then on the other side, you enter from the outside to the inside, and after that both the sutures should face each other, and after that you will tie the instrumental tie, and the knot, it will be buried into the deeper tissue, and you will cut very close to it with the help of the scissor. Now you are seeing clearly that knot is buried into the deeper tissue. Mostly we do it to reduce the dead space. Again, you will focus on the movement of needle. Enter from the inside to the outside, then outside to the inside. After that, sweep from the tissue, and then finally instrumental tie is there. And finally 3 to 4 knots. Especially if prolene is there, you can take more knots as the knot slippage is more. Now you will cut it. So finally we did it. Next step of the suture, it's the vertical mattress suture. It is also known as far and the near suture, and you can focus there the movement of the needle. At any point you will not touch the needle. You will hold the needle, even you will adjust the needle with the help of the forceps. Now in the first go we have taken the needle from the very far, and after that both the edges very near. It is known as the far near. At the end instrumental tie is there. At one side your hand should move on one direction, and in the next go your hand should move on the other side, and finally we did it. Again you will focus on the movement. Sutures should be tied for the best approximation purpose, and it's a learned skill. It will improve day by day. The more you will practice these sutures, the more excellence you will gain. For the best approximation, we will excel the horizontal matrix suture, and you will again focus on the movement of the hand. You will enter from the one side at 90 degree, you will exit from the other side at 90 degree angle. Then you will take some distance, and after that you will enter from the outside to the inside, then from the other side, from the inside to the outside, and the two sutures, they will lie parallel to each other. And finally there is the instrumental tie. At one point your hand is moving in one direction, at other point your hand is moving in the other direction, and finally cut it. And you are seeing that both the sutures, they are parallel to each other, they are horizontal to each other. And finally again focus on the movement. It's a learned technique. The more you practice, the more you will gain speed, and the more you will excel in this skill. So finally again with the help of the tooth forceps, you will hold it, and finally at the end we are tying it. So this is done. Finally cut it. Now you will excel the figure of 8 suture. You can closely watch the movements of the hand. You must be clearly seeing that at any point I am not touching the needle with my hand. I am holding the needle, I am readjusting the needle with the help of the forceps. Now final you are seeing that it becomes the figure of 8 when we tie it. Finally at the end cut it. At some situations we apply this stitch. At this point I must tell you that the suture should not be too tight, it should not too much relaxed. Finally simple running sutures are there. Again you will enter from the one side, you will exit from the other side at 90-degree angle. After that you will tie the instrumental tie and you will sweep the tissue, you will continue in either direction and you will not lock it. You will continue running the suture from one side to other side, from one side to other side, from one side to the other side, then unless to come to the edge of the skin, and finally there will be the loop. So with the help of that loop you will tie the instrumental tie, and finally almost we are at the edge and you are seeing that one loop is there. Now one loop it is formed and we will tie with the help of this loop. So our simple running sutures has been completed. Now cut it. Now another type, which is the simple, the subcuticular stitches. It's to somehow difficult. You enter from the one side, you will take some of the deeper tissue from one side, then from the other side, again from the one side, from the other side, and you will sweep, you will move in one direction. You will take some of the deeper tissue, you will not take most of the deeper tissue, you will remain very close to the edges, and cosmetically this stitch is beautiful. Finally when you will see the scar, it will be beautiful as compared to the other type of techniques, until unless you come to the end. Now you are not seeing any suture over the skin like in case of simple interrupted, simple continuous locking sutures. So at the end cut it, cut the other end also. So finally we did running locking suture, and again it is almost in we will apply in the same view as we applied a simple running suture, but we will lock it bit by bit after every stitch. Again cut the shorter end, and after that continue either in one direction. Well, and finally the last type of the suture, which is the simple running locking suture. You take from the one end, then after that take the tie, after that pass from the one end, pass from the other end, then at every step lock your suture. At every step when you will lock your suture, meanwhile you will continue either on one side unless you come at the edge. Now you are seeing on the screen that at every point we are locking the suture. This is the simple running locking suture. So finally at the end tie it, that's the instrumental tie, and at the end you will cut it. So if you like our content, if you learned something from our videos, then do subscribe by clicking on the red button below. So thank you so much.